I never had that much experience for this, that I can treat patients like OPD basis or some of critical patients, but how to do this, how to tackle that fear.
It's something that is beyond us to be treating COVID patients who are on the verge of dying.
First time when we received a sample, that was the Triage area. So that time all the technical persons and doctors, they have fear that someone gets infections.
We were not sure about the natural history of the disease, which is the source of infection, how it will get transmitted, and who all will be the susceptibles.
મેં આવું જીવનમાં આટલી મારી 43 વર્ષની ઉંમરમાં ક્યારે આવું નહોતું જોયું. આ પહેલી વાર જ મેં આવો અનુભવ કર્યો.
Courage that I need for to entering ICU, that I need someone help.
And by March, it was quite evident that okay, we also are not going to be safe from this. So I was one of the first ones who was posted in one of the largest hospitals of Asia.
The most the decision what we have to took is that we have to postpone our planned surgery. Like patients of cancer surgery who are waiting for surgical treatment, we told them that you are suffering from cancer and we could not treat them for time being.
Biggest challenge that we face in the microbiology laboratory is to gather the resources.
It was a very frustrating first day, and at that time there was a thought, should I continue this or have to quit?
The most difficult decision was the triage of the patients.
One or two doctors posted in the triage area. They were always calling us from the ICU that, doctor, do we have vacancy? Do we have vacancy? Our answer was that just one patient got declared death and there will be one vacancy for that. But we need to clean, we will tell you in 5 to 10 minutes. And he was saying, doctor, this patient is also dying. Please do hurry. This was the grey area that we have to take patients on the cot when one patient dies.
Being doctor is not something where you can have a superpower of dealing or managing things. It made me more humble. It made me realize that being doctor, we are just messengers or conveyor of the system that we learn over the period of time.
The moment I realized the gravity of that situation was when I saw the number of deaths firsthand. When I got COVID myself in the middle of my exams, I remember trying to find a cot in my own hospital, and I had gone to the basement where I saw a separate exit just for the dead, and I could see stretchers lined up covered with covered bodies.
કેટલી ડેડ બોડી પેક કરી કવરમાં, કાળા કવરમાં. અમને બહુ દુઃખ લાગતું હતું. કોઈ તો જવાન જવાન છોકરા હોય, કોઈ આમ 20-22 વર્ષના હોય, કોઈ 30 વર્ષના હોય, તો જોઈને આપણે જીવ બરી જતો. પણ હવે શું કરી, કામ હતું આપણું.
Like there was an entrance for doctors and there was a side where a net was placed, so the relatives of the patients who were inside could not come inside. And like I just peeked outside and I could see how scared they were because they can't see their relatives. That is the worst point.
We have to say no, that you cannot meet your children right now, but when you will recover, you will definitely meet your children. But unfortunately, that lady didn't survive. So, yeah.
And some of patients like father and mother will be housewife. Mother would be housewife. and there are 2 children, and he was the only earning person for that. What if he loses his life? What about family? That one line that mother always say કે આના કરતા મને લઈ લીધો હોત તો વધારે સારું હતું એમ.
I remember small kids being isolated alone and their parents outside screaming and asking for answers.
We actually heartbreaking situation when many of our colleagues get affected and they required oxygen. Many of them they require positive pressure ventilation, and we were helpless.
જો પેશન્ટને બાથરૂમ સુધી ચલાવીને લઈ જવી તો એનું ઓક્સિજન ઓછું થઈ જાય એટલે અમે એવું રિસ્ક નહોતા લેતા ને બધે ખાટલે ખાટલે જ પાચ ને બધું કરાવતા હતા.
If we can survive this patient, we can support more, even severe disease with the efforts, with positive intent and with the help of God, we can treat COVID.
Small things which worked. First of all, in the morning we had a prayer, all of us. And doctors, everybody who starts the work had a prayer, and thereafter we had our psychiatry department who went on giving some psychotherapy to whoever is vulnerable.
And one important thing, not only paramedical staff, even laboratory servants from class 4 to class 1 all have played their role very well.
Each and every person from the medical fraternity, starting from the servant to the higher post doctors, they all were united to save the patient's life.
So we develop a different strategy, that we develop not a definitive care in one go. We develop a strategy of step-up procedure. The surgical steps which require immediate care, we did that. For example, if there is a abscess, we used to normally in normal condition we do incision and drainage. In COVID patients, to reduce the admission, reduce the exposure to the healthcare patients, we started doing aspiration.
So what we did is that we were a big hospital, we could manage more critical patients, so we reduced the non-critical beds and increased the critical beds.
And such diverse characteristic of every population, you cannot have a uniform message for everyone. This is when the leadership also played a pivotal role.
Making them wear masks in such hot and humid environment was also a task. Convincing them for practicing the social distancing and stopping the overcrowding at the places. So that was the biggest task.
In India, the biggest challenge is to sensitize people about importance of their own health. It's not government's responsibility, it's their own responsibility. And this was quite clear as a mix of both the government efforts as well as people's perception.
અમે આઈસીયુમાં જઈને એમ્બ્યુલન્સમાં જઈને અમે ટ્રીટમેન્ટ આપેલી છે.
Most significant intervention was Triage itself, because we introduced the practice of home isolation and self-monitoring of health by the community by monitoring of the SpO2 levels at the most peripheral level.
Flattening the curve and imposing the lockdown, lifting the lockdown, and thereafter course correcting the strategy and converting the major lockdown into micro containment zones and the buffer zones, and thereafter only the cluster of houses which were getting affected. So the policy also evolved as the time progressed.
There wasn't a single moment. The whole pandemic duration was filled with such moments. Every single patient was trying to survive, not only for self but everybody else around him or her, and that made us work harder and harder. We are not even aware of how many hours of sleep we did get.
અમે એવું કોરોનાથી ડરીને રહ્યા છું તો અમે કેવી રીતે કામ કરશું, તો આ બધા લોકોની સેવા કોણ કરશે એમ.
The things became easy because we could cater resources, we could build infrastructure, we could have the manpower trained. So all these things really helped.
So everybody knows India ran the most extensive vaccination drive. The best part about vaccination drive was there was no preferential treatment. The government actually identified the high risk groups. If I can put up an equivalent of Triage in disaster management, the government identified who were the people who would be most benefited by the vaccine.
And even the drive-in testing facilities, they were also introduced in the corporation area.
I'm really a small person to comment on the whole nation, but as from my standpoint, it did amazing. India did amazing.
Education of the patients is a difficulty, and then also with everything, the minimum number of ventilators, minimum number of all the equipments, we could manage it, and with the government support we could manage so much of equipments at that time.
Along with that, our medical students, paramedical students, interns, they were helping monitoring the health of the patients at their own homes.
It's not only one microbiologist, it's a teamwork from admin to clerical staff to servants to class 1 microbiologists.
Within a span of 1 or 1.5 years, India was exporting not only the masks but also PPE kits and so many protective equipments to other countries. So many countries were benefited because of India's leadership and India's initiative of vaccine.
When it comes to dealing with such a huge population, I think we did fabulous.
Even if one patient came out of this critical situation, that brings a hope in our minds.
I'd say the future is unpredictable, so hold on to your loved ones. You don't know what is going to happen.
Life is uncertain. Take care of yourself and be happy.